Hi, my name is Dr. Nerida Bates, and I've known Pastor Trevor Barnes for quite a while. He asked me to talk with you today about some of the things I know about COVID. I am a pediatrician, and I also have my PhD in cell biology, and I used to teach the medical students virology. I used to teach them about SARS and beta coronaviruses. So, why is COVID so much different than other things like colds and flu? First of all, colds and flu are mainly spread by getting mucus on your fingers, touching doorknobs, getting that in your mouth or your eyes. COVID can be spread that way by young children and parents who share a lot of secretions, but it's mainly spread by aerosols. So it's actually spread a little bit more like TB. And these particles are so fine they can hang around in the air for quite a while and infect somebody who comes along later. The other major thing that's really different about COVID is that half of people have no symptoms. It's not even that they have a cold and don't know it's COVID. They just have no symptoms at all. They didn't know they're sick. So they didn't know to get tested. They didn't know to stay away from people. And that makes it very, very difficult to stop the spread. The other thing that's quite unique about COVID is that even these asymptomatic people can have life-altering damage to their lungs. Now, a lot has been said that the majority of people who die of COVID are over 65, even over 80, or have risk factors. But you know, those risk factors are not something that we can just get rid of instantaneously. Boy, I wish I could just go like that and lose 30 pounds. That would be wonderful. But those things are hard to change, and so quite a few of us are at increased risk for things that are difficult to change. We also know that about 1% of the population or so has a genetic risk factor. That means a small percentage of people who are healthy and young and have no problems just die, and it often goes through families where half or 3/4 of the family that catches COVID dies from it, even though you wouldn't expect it because of risk factors. And the last thing about COVID may not be unique to COVID, but it's one of the conclusions that I've been coming to, and a lot of other physicians, and that is that over the next several years, almost everyone in the world will be exposed to COVID. And so this is something that we all have to think, how do I deal with this? Because I probably can't avoid it. Now, we've all heard of some things that we can do to help not catch COVID. First of all, we all know that wearing a mask can be helpful. So I'm just going to go over some of the things about mask wearing that's most beneficial. First of all of your masks should have a little metal clip to help them fit across your nose. Second of all, they should be snug. And third of all, try not to touch the mask. So when you're wearing a mask and eventually it comes down over your nose, pick it up here by the elastic and move it back up. That way, you're not touching the tissue of the mask, the fabric, and making it wet and more likely to transmit COVID through it. Now, a mask like this is 50% effective at preventing the spread of COVID, so that's really useful. A mask like this, a surgical mask that's nice and tight over your chin and nose, that's 70% effective. And if you're really at risk, you can use a KN95 or an N95 mask. Again, fitting on your nose. It fits tightly and it will give you creases around your face if you're wearing it correctly. And that's 90% effective against decreasing spread. I also like to wear glasses. I don't usually use readers when I'm outside, so I have a pair of safety glasses that I wear when I'm out and about in the grocery store. And sometimes I even do the readers and the safety glasses. Wearing glasses, even prescription glasses, can decrease the likelihood of catching COVID by 30%. And that's because the aerosols don't just fit in our nose, they also can settle on our eyeballs and infect us that way. Now, you've heard a lot about washing hands, and that's important. It's not as helpful to wear gloves as it is to wash your hands. And I like to wash my hands when I'm done with the grocery store as I get in my car so that I'm not bringing something home into my clean space. We know that decreasing the number of people that we're exposed to will help us not catch COVID. And so we can do our socializing outside at a distance. Now I know this doesn't fit very well in winter, but it's a good solution to have get-togethers outside in the sunlight. The best way to prevent catching COVID is to get vaccinated. And there's also some data that having higher vitamin D, zinc, and vitamin C levels might help in the early stages of COVID not to get so sick. Now, vitamin D can be got by going outside in the sunshine without sunscreen and enjoying some sun on your face for 5 or 10 minutes every day. Now, what happens? What's the problem with catching COVID? A lot of people come to me and say, look, I'm young, I'm healthy, I don't have even a 1% chance of dying of COVID. But that doesn't mean getting COVID is just like the flu. The risk of getting life-altering disease after COVID is much, much higher than the flu. There have been some studies that suggest that a quarter of people who have any form of COVID, including asymptomatic COVID, never knew we had it, COVID, end up with some parts of their lungs damaged that we can see on CT. We have to be careful because these people shouldn't scuba dive, they shouldn't skydive, and if they are to get lung disease in the future, that 5 or 10% of lung damage that they have will be added on to future disease, and that's really discouraging. There are several kinds of heart diseases that are common with COVID. Disease of the heart muscle called myocarditis. You can also have heart attacks by atypical methods, particularly from fast heart beating. And sometimes the fast heart beating and the poor blood pressure control stay with you for quite a long time and perhaps permanently after you recover. We know that COVID causes lots of microclotting inside the blood vessels, and this microclotting probably occurs in people who are asymptomatic too. It probably occurs in the liver and the kidneys and the brain, and it's like tiny, tiny, tiny strokes. There are also big strokes that happen with the disease, and all of these are concerning because they're permanent. There's an increased risk of dementia and Parkinson's after COVID. There's an increased risk of impotence and infertility, especially in men. And not all of this goes away. And this is why for children and young men to be catching COVID and thinking they have no consequences is a bad idea. Now, anytime you have an infection that you make antibodies to, you run the risk of an autoimmune disease. The antibodies that you make to the virus can accidentally recognize the wrong part of your body and cause a disease. One of them is Guillain-Barré disease, which is a type of paralysis that's usually temporary. But there are other autoimmune diseases that we see. MIS-C is one of the autoimmune diseases that we see in children. And this is really concerning because, like its sister disease, Kawasaki's disease, there can be heart muscle damage that's permanent in these children. Most of them recover, but half of them seem to have a permanent component of scarring from that disease. Of course, what we worry about with COVID is those people who get fulminant lung disease and multi-organ failure and die. And this happens in the elderly at a rate of about 5 to 10% in some situations. Overall, about 1% of people. And after COVID, after you've recovered and got better, you can still catch COVID asymptomatically and spread it. This is really unique to COVID. Now let's turn our attention to the vaccines. The vaccines help you make one antibody out of the several that are made after the disease. And that antibody can have some of the same problems that the disease has, but at a much lower rate. Now, there are two other things that the vaccination does have that are concerning. One is you feel crummy. You want to stay in bed, everything hurts. Some people run a fever, people get migraines for a couple of days. Half of people who get the vaccination will feel crummy on the first vaccination or the second, sometimes both. If you are in extremely delicate health and you expect to be improved, so if you're on chemotherapy or if you have a major infection, a UTI or some other problem, and you expect to get better, now's not the time to take the vaccine. But it's important for you to get it because those factors set you up for extreme risk of dying of COVID. There's also an extremely rare allergy to something called polyethylene glycol. Polyethylene glycol is in toothpaste and hand creams and almost all makeup, some kinds of pastry thickeners. You would know you're allergic if you've had swelling and trouble breathing after a vaccine, after a colonoscopy, after using certain products on your face or toothpaste. And you would need to talk to your doctor, take your EpiPen with you, and be observed when you get your vaccine. Now, there are a list of things that are associated with the vaccine that, as we said, are much less common than if you catch the disease. Getting a reactivation of shingles or Bell's palsy are both possible, but less common than if you catch COVID. Myocarditis is less common than with COVID, but of course we worry because it happens to younger people, especially younger men. It happens about 2 to 10 times in a million, and almost always they recover completely without permanent damage. autoimmune disease can be triggered by the vaccine because, again, you're making an antibody, and if that antibody cross-reacts, there is a rare risk of Guillain-Barré and of an autoimmune disease called ITP that drops your platelet count and makes you bleed. Both of these are more common with the disease, and both of them can be treated, and we're watching out for them. Some brands of vaccines are associated with strokes. And again, depending on the brand, the non-RNA vaccines are associated with a 1 to 10 in a million risk of some form of clotting. 1 in a million for strokes, and milder forms of clotting may be a little more common than 1 in a million. But altogether, it's 10 in a million are the sort of odds. Again, that's compared to people who have COVID, who have 10 to 100 times more risk of clotting and stroke. And one of the problems with the vaccination that we weren't expecting is that in some situations you can catch asymptomatic COVID and spread it. But unlike people who haven't been vaccinated, you spread it for a shorter amount of time, you spread it to fewer people, but unfortunately you can spread it. You can still spread it after COVID, and there's some discussion as to which, if you're post-COVID or post-vaccine, you probably spread it about the same, much less than people who have COVID for the first time. So I think the odds ratio, the risk, particularly when we're saying over the next few years, 95% of people will be exposed to COVID, your risk is best served by vaccinating. Now, I want to say just a little bit about vaccines, particularly mRNA vaccines. mRNA is the part of, it's a sequence of bases that every 3 counts for an amino acid. And so at the ribosome, the RNA sort of snakes up to the ribosome, and every time there are 3 bases, an amino acid is added on, and those amino acids are zipped together to make a protein. And the protein that it makes is the spike protein, the outside part of the virus. It's the part of the virus that if you have an antibody to it, the virus is usually killed before it gets inside the cells. Now this mRNA can be put inside little bubbles of fat. And those bubbles fuse with cells in the muscle when they're injected, and the mRNA goes into the cytoplasm. That's the working part of the cell, and makes the protein. It's worth noting that mRNA cannot get into the nucleus where the DNA is. It's not allowed in the gate. And if it accidentally was pushed in through the gate, there are enzymes in the nucleus that would break it down immediately. mRNA does not get near DNA. It just doesn't happen. And fortunately, when you express the spike protein on the cells, you make antibodies, and you have cells that function like antibodies called cellular immunity. So you make 2 kinds of immune response to the spike protein, to the virus. These viruses have been wildly more successful than we thought. We thought a good vaccine would be 80% effective. And to have one that's 90–95% effective is really amazing. It's also worth knowing that mRNA vaccines have been around for several years, and while they haven't been used on everybody in the United States, they have been used widely in Africa, for Ebola. Healthcare workers in Sierra Leone and Liberia are almost all vaccinated against Ebola. It was also used for the Zika virus. And so for about 5 years, we have known about and used this type of technology. Now, I'm sure that you can tell me sad stories about COVID. This is the sad story that I want to tell you. Davy Macias was one of our nurses in Loma Linda University. She was nervous about getting vaccinated because she was pregnant. Her husband also didn't get vaccinated, and both of them got COVID. When Davy was 7 months pregnant, they had to do an emergency C-section, and the baby is in intensive care. And then both Davy and Daniel died of COVID before they even named their baby, leaving 5 children orphans. The amount of emotional loss, the amount of she was a good nurse, and that resource is missing. He was a good teacher, and society has lost that. We've lost parents for these children. And so I just want to say that as Christians, we need to remember our community, and that these numbers are people, and people that were loved and missed. Now, I love a good discussion about medicine, and I have been so pleased to find that physicians have created private sites on Facebook where every new article is posted, and there's vigorous discussion, even arguments. No, that study's no good. It was done in United Kingdom. They gave their vaccines 3 months apart. That's different than the US. Well, that study was done in Israel. And this is how science works. I think most people don't know that, but I have just been so pleased to see physicians arguing and working and thinking and designing and asking questions and giving answers and sharing data until we come slowly to consensus to know what to do that's best for our patients. So please pray for your medical staff. They're working hard, and they're studying hard as well. Now, I have a question for Pastor Trevor. And my question is, where in the Bible does it say that your personal freedom is more important than your responsibility to protect the community? I can't find it. In fact, when Jesus healed the lepers, what did he tell them to do? They had the right, the personal freedom. They knew they were healed. Jesus knew they were healed. What did he tell them? He said, go to your public health official, your priest, and get examined and follow the mandates of the government to help control this disease. And so I'm going to leave the rest of that topic to Pastor Barnes. Lastly, I sure hope that you have had a doctor or a nurse practitioner or 2 or 3 that you trusted long before this pandemic, that you know they have your back. And I hope you go to them and ask your questions. I think one of the easiest ways to ask your questions is to say, I hear people are saying, because it leaves the topic out there and it doesn't attach it to you. And then you can talk about the topic and not worry that anybody's being labeled. Your physicians have sworn an oath to protect you. They're working hard to make sure that they can help you be the healthiest that you can be. So please ask us your questions.